We're back.
Hello.
Hi, everyone. Welcome back to Do Your Parents Want to Stay Home, a virtual weekly caregiver education series. And I'm Infinity Martin. I am the Community Health Engagement Specialist here at Sugar and Spice in Home Care. And we are a nurse-owned and operated chronic disease management caregiving
That's a
agency,
mouthful.
proudly serving Flagstaff and roughly 1 hour radius surrounding.
Yes.
Yes.
All right. Very nice. And I'm Regina Deck. I am CEO of Sugar and Spice in home care. I'm a nurse, and patient educator and elder care consultant, bunch of other stuff. But anyways, we're here today to talk about another topic. I believe this is video 8,
Seven?
7.
I think
Okay,
seven.
7 or 8,
Okay.
one of them.
Yes.
Talk about medications today.
hmm So, what's one of the most common problems that you see with medication with seniors in their homes?
Right. So, for those of you who are a family caregiver for somebody who is wanting to stay home as long as possible, or maybe they already live in a facility, um, medications are a huge part of any senior. I guess that's not entirely true, right? There's some that are completely healthy and maybe just take a vitamin or two. But I would say for the majority, medications are a big deal for a lot of families. There can be medication changes that can come up, but I would say just right off the top, some of the most common medication problems that we see are for seniors that are trying to manage their own medications is they'll take the wrong amount, they'll take them at the wrong time, they forget to take them, and then or they forgot if they took them or not, so then they take another one. Um, it can also be where like we have a couple in their 90s that they were trying to manage their medications. They finally let us take over, but one of the things is that the wife was taking her husband's thyroid medication.
Ooh.
She thought she had the thyroid issue, and it was really him.
hmm
So there can be a lot of different things. Some of the other issues that I've seen is that these pills are just really tiny and a lot of times they get dropped, right? Because the dexterity kind of goes away. Sometimes people have neuropathy in their fingers, so they're not able to feel them very well. And so just dropping them can happen a lot. They just end up on the floor. And then you have a concern like if you have pets that
Right.
are scooping up the pills that are on the floor and then they're taking them, that can be deadly to your pet
Right.
or at least can make them sick. So, the other thing I think that's really hard sometimes is just managing the pill bottles, just opening and closing them. And then I've seen where a lot of seniors have a hard time reading the print on the bottles because they're so small. So, one of the things that Sugar and Spice can do, having nurse oversight, is that we can provide medication management for our clients. So that can mean just coming in and maybe restocking medication sets. We have a handful of clients that I do that for once a month, and we just get like 4 or 5 of those weekly medication sets, and then I can go in and just stock for an entire month at a time, and we
That's
label
helpful.
them. Yeah, we label them with the name, and I put like 1 through 5. We have an extra week. That way,
hmm
they don't ever run out in the meantime of getting them refilled. So that's one of the things that we can do. That way, we can kind of tell too if we have a caregiver in the home that's coming in and out. The caregiver can help remind them to take the medications. The caregiver can see if they've been taking them or not, if they're still in the cubbies or not, pick them up off the floor, those kinds of things.
Yeah. Some of those pills are so tiny, and
Yeah,
then sometimes the doctor even says take half a pill.
right.
Yeah. And I mean, how do you even cut it in half
Yeah.
without dropping it?
Yeah.
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 So,
So we can do all that. We can cut them in half and put them in as half tabs in each section. But you're right, it's very hard sometimes even if they are in a cubby, then you're like trying to dig them out and it's hard. So, that's where having a caregiver come in and assist with those things can be helpful. We can transfer them to a little cup for that dose
okay.
for that time of day.
And the sugar and spice caregiver can also crush it up and,
Sure.
do extra things if they need, right, to help them take in?
Yeah, so some of these pills are like horse pills, or they're really hard to swallow. And so if it's safe, if the pharmacy said it's okay for them to be crushed, then you
Hmm.
can crush them and mix them up in applesauce. We've had a client with a peg tube, and we got really creative because everything had to go into water and then into the peg tube. And so we set it up to where the caregivers um, could well, I won't go into it because it's a whole thing, but we can get very creative. We can do a lot more with medications at Sugar and Spice than a lot of other agencies can. Some agencies for in-home care have policies that they just can't touch the meds at all.
Hmm.
So we're fully involved with that. We can, because we have nurse oversight, we can regulate that and make sure that the caregivers are safe and competent to assist with the medications.
That's awesome.
Yeah.
And what are some red flags for maybe some interactions with drugs or
Yeah, like if they're
like side
taking,
effects if they're taking, yeah,
yeah,
if they're taking too many meds or
right. Yeah, so polypharmacy is that basically it's where there's too many meds coming into the house that maybe, and this can happen through when there's multiple pharmacies involved. So sometimes people have a mail order pharmacy that will send meds to the house, but then they also have a pharmacy that's local if they have something that they need quick, or an antibiotic refill or something like that. And
Mhm.
so then the two pharmacies may not be talking. And so they're checking their dosages and they're checking their dosages, but they don't know about each other's meds. So
Wow.
that's where you can end up with too many. We did have a patient a while back that was on, my goodness, when we signed her on, I think she was on 3 or 4 different blood pressure medications.
Wow.
And they were definitely causing some issues with her. And she had, periods of altered level of consciousness. She had stomach upset, just weakness, dizziness. She'd feel lightheaded at times. So I guess to answer the question of what's red flags with medications, it really can be a lot of different things because medications cause so many different kind of side effects. But I would say watch out for just any new changes with a new dose, or if they, just are sleeping all the time, or their stomach gets upset, and you can kind of track, oh, about an hour after they take these meds, they lose their appetite, they get nauseous,
Mhm.
they, you know, maybe something along those lines. Let's see, also with some new antibiotics, they can be really upsetting to the stomach. So sometimes we can do things like ask the doctor to um, instead of like a big dose in the morning and the evening, maybe they can split it up for it's a smaller dose 3 times a day.
Mhm.
That can be a little easier. And then that's also where it's nice to have a caregiver there, because a lot of these things are tolerated better if they eat something first. So just having
Right.
somebody there to say, hey, let's make you a small something to eat first and then give you the meds. And
Right.
other things that we like to do is if somebody's on a new antibiotic, um, in addition to the side effects of GI upset, sometimes antibiotics can cause another problem at the opposite end, like literally the opposite end of the body.
Mhm.
Women are prone to getting yeast infections when they're on antibiotics because there's that balance of yeast and bacteria in the vagina, and
Mhm.
so you knock out the bacteria, then the yeast is like, oh, more room for us.
Right.
And so then they can take over and then you develop a yeast infection. So
Mhm.
um, sometimes what we try to do is advocate for a probiotic to be given. You have to spread it out a little bit. You don't want to give it with the antibiotic because it'll just kill all the probiotics anyway. So you kind of have
Okay.
to give the antibiotic, wait, and then in the middle of the time between the 2 antibiotic doses, you give the probiotic.
Okay.
So that helps kind of restore some of that natural biome in the gut, and helps with the GI issues, and then also helps prevent the yeast infections. Also, things like a yogurt can help
Okay.
restore some of that bacteria.
Um, so it doesn't affect the antibiotic working?
No.
Okay, it would just kill the probiotics if you do it too close.
Right.
Okay. All
Yeah,
right. Okay.
exactly. Lots of little tricks we try to do for our folks to ease them through an infection. But yeah.
Yeah, yogurt's a good one to coat the stomach.
Hmm.
Yeah, I've done that with
Yeah.
my boys a few times.
Yeah, it helps.
Let's see. And so you went over this a little bit, but what difference does it make when the RN is involved as opposed to just, a caregiver or a caregiver agency where an RN is not on,
Sure.
on staff
Well,
24/7?
well, having a nurse on board, I think can be super helpful, kind of like I was saying, because we have all these other tricks to kind of help with that. But having a nurse oversight or a caregiving agency like Sugar and Spice is really helpful because sometimes our family caregivers are not always with the with the client. They might live in another state or another town or something.
Hmm.
So let's say you're caring for your mom, she starts having symptoms of a UTI. The doctor is contacted. Now they need a ride to the lab. They're already not feeling great. Maybe they're having some dizziness. Maybe they're confused because of the infection. Maybe they're weak and they're more of a fall risk. Now it's nice to have a caregiver be able to be available to help get them to the lab. So we can do things like that. Get them back home. Once the lab results are in, we can, this is where you're kind of answering your question about the nurse, is to just coordinate getting those picked up, brought to the house, set up in the medication sets so that there's no confusion about when to take them or, any of that. So we can go in and get those up and running quickly and then monitor all the side effects that can come with that and the effects of whatever infection they are dealing with.
Okay.
Yeah.
Yeah, that's good to have it quick, especially with antibiotics because, if you wait, that's never good.
Right. Yeah, and I'll say too that um we have some clients that are in facilities
Hmm.
that we have taken care of them and we have the clinical oversight there. And so there's been some really great opportunities for us to help folks that are already in a facility but be able to provide one-on-one care with the medications to where we can help facilitate them getting them faster.
Okay.
And so it's a little bit of a unique situation because a lot of times the facilities are in charge of all the medications, but there has been some times where Sugar and Spice has been able to work out something with the facility and the family to be able to be in charge of the medications. So
Mhm.
then we can have a little bit faster response times of uh, getting all that stuff done quickly because we're assigned one-on-one to them so we
Mhm.
can get the urine collected, get it to the lab, follow up with the doc. Yes, the meds are ordered. Go get them, bring them back, get them all done and started within 24 hours or so. So
Right.
sometimes. And we can do the dip test too. We have strips for urine tests, so
Okay.
we can get a preliminary test and then send it off to the lab for the culture to make
Hmm.
sure that we're getting the right antibiotic. But just lots of extra things that we can provide for clients that are with us.
That's really
Yeah.
nice. Yeah, definitely one-on-one helps.
Yeah.
Yeah. Let's see, what else do we have?
I wanted to talk a little bit about, um, so I'll give you some scenarios. So back to our little couples that are in their 90s. Um, gosh, they're so sweet. I love them. But they live independently in their home. And something that really could have caused a whole lot of problems for them was that, well, one has glaucoma and the other one had cataracts. And they ended up having surgery a week apart from each other.
Wow.
So what happened was this created a whole slew of different orders that had to be done, right? So
Hmm.
there was a whole bunch of extra doctor's visits that had to be done and tests. And then the surgery, like before the surgery, gosh, this was like a year ago, so I'm trying to remember, but I think there were some extra drops that had to be given. before. I think they may have even started them on a prophylactic antibiotic just to ward off infections. And so our visits once a day for an hour turned into 2 or 3 times a day that we needed to be in their home. And then the extra trips to the doctor's appointments, picking up extra medications from the pharmacy, and then just getting all of that care plan adjusted and in a simple format for all the caregivers to follow. Um, but it was, yeah, there were like extra drops for pressure in the eyes that were added. Um, and then yes, antibiotic drops and creams. And then when they had the surgery, then there was increased fall risk because they came home with like patch on their eye.
Yes.
Right. So then their equilibrium's off a little bit and their ability for um, proprioception was off a bit. And so it's just, those kind of things were managed easily because we already had caregivers there. And so it made it possible for them both to get these surgeries done and all the extra stuff that came with it.
Yes.
And fall prevention, meal prep, handling all the medications. She for sure couldn't see the pill bottle.
Right.
After that. She had a
Betcha.
hard time seeing it before, and she for sure couldn't see it after. So that was really helpful. Also, let's see, with that client, I'm thinking there was something. Oh, I know what it was. He had in the summer, the gentleman, he has a lot of edema. It's just with the heat, and they keep their house really hot, and they got these big, beautiful windows, and the sun just comes in, and it's like a sweltering house for them in the summer. And so he like swells up, his ankles swell up and things like that. So um the doctor ended up ordering a diuretic for him. He got Lasix going, but with Lasix, you also add potassium because you pee out all your potassium when you're on Lasix. You pee out a lot of it, so then you have to put it back. So then he was taking these massive horse tablets that were like this big of potassium tablets. And so it's just, those are some of the things that it's just really nice to have a nurse on staff because we can do that oversight for our clients and make sure that they're getting well taken care of. And then inevitably what happened with this gentleman is that then he really had a lot of urine output, and he was not used to having that many trips to the bathroom. So then he did have some accidents that we were cleaning up, um but yeah, sometimes with one little thing that gets off, it can cause a whole cascade of things for our folks.
Absolutely.
Yeah. So it seems like our seniors are really prone to that. One other scenario I can think of with a client was where he got an infection. He ended up, I think it might have been another urinary tract infection. They're just, seems like one of the most common ones, but he got an infection, and then he had a lot of more weakness. He wasn't sleeping well at night, so then he was sleep deprived, and then he was kind of dizzy from not sleeping well, and he wasn't eating well. And so he was on the antibiotics. He was starting to get better, but then he fell and he broke his arm.
Oh man.
So now he's back in the hospital. Now he has to have surgery. So then he's going through the anesthesia, which lingers for a long time in our seniors because our kidneys and liver just take a lot longer to process those toxins. Yeah, those not toxins, but those chemicals out of our system. And so the confusion and that hazy brain kind of lingers for a long time. So then he came home from surgery, but he was not doing well. He was not eating well. He was in pain. He still wasn't sleeping well. His nights and days got completely flip-flopped in the hospital, just from being awake a lot at night. So then his wife was trying to take care of him. He was sleeping a lot during the day and then awake all night long and being a fall risk and in pain and, just needing a lot of things during the night. And she got sleep deprived, and then it just kind of, that's where I'm saying it. Like one little thing can snowball into a bunch of other stuff.
Absolutely.
And so sometimes you just need some extra help.
Yeah.
even just to get you over the hump of something
Mm-hmm.
like that,
Yeah.
or to prevent things from getting worse. It's
Right.
really nice to have extra help.
Agreed. Well, do you have anything to add?
I don't know.
That was
I think
really
that's about
good.
it. I know there's a lot to talk
I
about with
finally have the introduction memorized. So I was really proud of myself.
antibiotics. I think that's it. There's a lot to go into medications that we
Mm-hmm.
can help with, but yeah, I think if you are a home caregiver, you're caring for your family member, there are some other tricks out there. There's a device. I meant to look it up before we got on here today, but I've seen this before. It's like an electronic pill reminder, and
Hmm.
it's accessible to a phone, so the family caregiver can see if there's any issues with it, but it has the ability to set off like a little alarm, and it opens this little hatch and the
What?
pills are there. Yeah, so you can time these, and then they'll set off a little alarm to remind your mom or dad to come take their medications.
That is so
And
cool. It's like
then
a little pill safe.
yeah,
Yeah,
yeah, like
the
a little
reminder.
beeper.
Yeah.
Right. Right. And
Wow.
then if there's any issues with it, and then I don't think it had, I wonder if it had an indicator of like, if they came and got the pills out of the container or not. I'm not really sure.
Hmm.
So you could call me like, Mom, it's time to go take your
Right.
pills. It
You
says
left the
you,
pill door open, you
yeah,
know?
yeah, you haven't closed the pill door.
Yeah.
So, but yeah, there's some things like that.
That's pretty cool.
I've also seen where people will turn all the pill bottles upside down the night before,
Mm-hmm.
and then as they take them, they'll turn them right side
Right.
up, and that is their reminder that they've taken that pill.
Mm.
But that's when they're like still with it enough to actually
Right.
pull the right medication out of the bottle at the right time, and they're not accidentally taking their spouse's meds and things
Right.
like that. So I think it all just kind of depends on where people are in their independence, but we can definitely help people maintain their independence longer, even if they live in a facility and they're on the independent side of
Mm-hmm.
things. Sometimes that can be the difference between someone having to move to assisted living or being able to stay on the independent um, division of a facility. And so we can definitely just come in and provide medication assistance. It can be as simple as restocking the meds once a month, or it can be daily reminders,
Mm-hmm.
um, and anything in between.
Yeah, that's amazing. Yeah, just to prevent that move, I mean,
Hmm.
for as long as possible.
Yeah.
That's really
Yeah. We
great.
want people to be able to stay where they're comfortable with their friends. And that social life is a huge part of their independence and their mental health. And
Hmm.
so just being able to stay independent as long as possible is huge for
Yeah,
people. If that means they
absolutely.
can stay in their home a little bit longer, or they don't have to move to the assisted living side of a facility, is
Hmm.
huge.
That is
Mhm.
huge. Yeah. Well, awesome. We covered a lot. That was
Okay,
good. Yeah.
cool.
Well, thank you everybody for joining us, and we'll see you next week on Facebook at 11 a.m. Mountain Standard Time for another episode of Do Your Parents Want to Stay Home?
All right, thank you for
Thank
joining us.
you.
Where is it? There it is.